What is the best miliary TB treatment for elderly patients? Imagine battling a disease that spreads through the bloodstream, affecting many organs at once. That's what miliary tuberculosis does. It's a serious form of TB that needs careful treatment, especially in older adults. When treating elderly patients, doctors must balance effectiveness with safety, since older bodies are more sensitive to medication side effects. The main goal is to eliminate the bacteria while minimizing harm. Standard treatment for drug-susceptible tuberculosis usually involves for drugs during the initial phase: isoniazid, rifampin, pyrazinamide, and ethambutol. This combination is typically given for about 6 months. But in elderly patients, especially those over 75, pyrazinamide is often avoided or used cautiously. This is because pyrazinamide can cause liver damage, which older adults are more prone to. When pyrazinamide is left out, the treatment duration is usually extended to at least 9 months to make sure the infection is fully cleared. In cases where the disease is very severe or the bacterial load is high, such as with widespread miliary TB, doctors might consider including pyrazinamide if the patient can tolerate it. Sometimes, fluoroquinolones like moxifloxacin or levofloxacin are added to strengthen the regimen and prevent resistance. Recent studies suggest that with close monitoring, pyrazinamide can be safely used even in very elderly patients, but this requires careful assessment. Because miliary tuberculosis affects many parts of the body, treatment often lasts longer than the usual 6 months. It can extend to 9 or even 12 months, especially if there are complications or involvement of the brain or other critical areas. The exact length depends on how well the patient responds to therapy and whether any issues arise during treatment. Monitoring is key for elderly patients. Regular blood tests to check liver and kidney function help catch any side effects early. Managing other health conditions and avoiding drug interactions are also vital to ensure the treatment goes smoothly. If drug resistance is suspected, doctors relying on testing to guide the choice of medications, sometimes using newer drugs like bedaquiline or pretomanid, but these are used under specialist supervision. In summary, the best approach for treating miliary tuberculosis in older adults involves a tailored combination of medications that are effective yet gentle on the body. Usually, this means using isoniazid, rifampin, and ethambutol without pyrazinamide in moderate cases, extending treatment to at least 9 months, and carefully monitoring for side effects. For more severe cases, adding fluoroquinolones or considering longer treatment may be necessary. Always, elderly patients should be managed by healthcare professionals experienced in tuberculosis care, who can adjust therapy based on individual health status, other medications, and potential risks. Remember, the key is personalized care, close supervision, and ongoing communication with your medical team to ensure the best outcome.